Hello. Hello. Welcome to the MBLEx review course. My name is Jodi Scholes, and I am your instructor. Today we are studying client assessment. Oh my goodness. So all those things that you do prior to inviting a client to get on the table. Or before leaving the room. So client assessment, reassessment, and treatment planning is our subject for today. Our class goes down in 3 rounds. Our first round is a test-taking strategy, and those are helpful to approach the test. Passing the MBLEx is not just about your knowledge. Passing the MBLEx is also a strategy. So in the first part of class, we talk strategy, test-taking strategy. Second part of class is our learning. And then the third part of class is dissecting questions. But today we have a special appearance. We have a special guest. And I would like to introduce you to Lance. Lance is in the great state of Florida, and he's going to share some good news with us. And so, Lance, what you got going on? Turn on your microphone. Say hello to our class.
Hello, everybody.
So, what was good about this week for you, Lance?
Well, I passed the MBLEx on February 27th, and
Yay!
yay! And it was quite a journey because I actually was a certified massage therapist in California right before the pandemic hit. So I went to the National Holistic Institute of Massage Therapy in San Jose, California.
Oh, love that program. Oh,
Yes, a very
Cynthia,
good program. I loved
yeah.
it there.
Cynthia Ribeiro is one of my heroes.
Yes, yes, I met her. Yes, she's
Yeah.
very awesome.
Mm. How long was
Mhm.
But in any case, the next stage is actually physically getting your license.
Hmm.
And we're happy to help with that, happy to uh, just be a sounding board. How long is this going to take? What else do I need to do? Those types of things. But let me ask you, how are you feeling?
Oh, I feel great.
Uh,
Yeah, I feel
and
relieved. Yeah, yeah, I studied really hard for a long time. So,
Oh, well, I am very, very happy for you. Thank you for being a member of the alumni support.
hmm.
Um, and that's how we continue to support you. In fact, let me mention, alumni support has an event coming up. Alumni support 4 times a year. We have a business roundtable. So mark your calendars. Some of you have already gotten the invitation and responded. March 31st on Monday. So Monday from 12 to 2. March 31st. That is our business roundtable. Tara and I planned the agenda, and we are so excited. So Tara is going to be speaking about self-care and burnout. Jamie, one of our tutors, is going to be speaking. So we've got a couple of guest speakers coming in, and I'm going to be talking about avoiding early career mistakes. So just getting you guys and normally, this would be just for our people who have passed the MBLEx. But because you guys are here and you're a Patreon, you get to go too. So you're a member of this community. And because of that, you get to sit in and hear everybody who's licensed and practicing talking about what it's like. So want to say thank you. Lance, what time of day did you take your test?
I actually took it at 5 o'clock at night
Five
in the
o'clock at
evening.
night. How did that
Yeah,
feel?
it was okay.
Hmm.
Yeah, the room was pretty full too when I went to Pearson View. Yeah,
Yeah.
it was very full. Yeah.
Wow, cool. So the test taking strategy I want to share with you today, Lance mentioned one, which is breathe, eliminate wrong answers. And I want to remind you that when you sign up to take your test, start looking well in advance. Start looking 60 days out, 45 days out, because you want to get a time of day that works for you. So that time of day is an important part of your process. I don't know if you can see the comments coming up in the chat.
Yes, I
So they're like,
can.
congratulations, whoa! Yeah, exclamation points everywhere. I love it. So consider the time of day. As you get closer to, so if you were to go, say, 2 weeks out, there's not going to be as much selection on times. So start looking now as far as when you want to test. So you get your authorization to test, you've got 4 months. 4 months. So about 30 days, or even start, just make your account with Pearson VUE. Start watching to see, like, are you a morning person? Do you want to take your test at 10 a.m., at noon? Do you work? Do you want to take your test at 5 o'clock, at 6 o'clock? So that you get a time that's good for you, look right away and see what's available. Now, I'll also warn you that if you change your time with Pearson VUE, cost you $50. Yeah. So just keep that in mind as you are imagining taking your MBLEx, envisioning passing your MBLEx. When you register early, when you register 2 months out, 3 months out, you're more likely to get a time of day that you want versus just what's left over. So, but thanks, Lance, for being here. Are you gonna hang out and watch class?
Yes, I am.
Awesome. So many of our graduates who pass the MBLEX come back because they're like, oh my God, I always learn something, you
Mhm.
know? And so today, so thanks so much for being here, sharing your story. Congratulations again. And you
Thank
guys got
you.
a sneak peek because his congratulations post hasn't even gone up yet. So, yes, so congratulations. Let's transition into our learning for today. All right. And we'll be talking about all things client assessment. Yes. So, client assessment, reassessment, and treatment planning, according to the Federation, is 17 questions on your MBLEX. 17. That's almost 20%. And many times, these client assessment questions are woven into other categories as well: pathology, anatomy. And so here's exactly what the Federation says is on you could be tested on. We're going to cover the majority of this today. So the organization of the body work session. Are you going to start supine or prone? How are you going to organize your session? Are you going to start with your client's primary concern? How are you going to organize your session? Are you going to do full body? Are you going to communicate with your client that you'll be focusing on one area? All right. That's in the client consultation and the evaluation. So we're going to do that verbal intake and look at their health history. We're going to collect some written data from their health history. We're going to review what it looks like to do a visual assessment with your client. We're going to do a general visual assessment, postural assessment, gait assessment, palpation assessment, a lot of assessments. We're going to do range of motion assessment. And then you're going to put all of those ingredients into your head. It's like making soup, and it may not taste like soup when you've only done part of those. But once all that information you've gathered, then you're going to use your critical reasoning to rule out contraindications, to be clear about goal setting for the treatment, to evaluate how your client's feeling on the table, and then to evaluate any other treatments that they've had, and use that as strategy for going forward. So there is an online scheduling software called Clinic Sense, and I really like their 5 steps. I wanted to just share them with you about creating the treatment plan. Now, I want to be clear about what I'm talking about when I say treatment plan. I'm talking about going forward. When the MBLEx talks about treatment plan, it's for future planning. This slide is about the day you're seeing them. So the actual appointment. So how are we going to be successful in this appointment? Well, the first thing is find out what prompted their visit. Why are they getting a massage today? And the components of this finding out what motivated their appointment today, what their primary concerns are, if they have any, is we use a health intake sheet. We do this verbal assessment or verbal intake. We do the little chit chat, but then you've got a physical piece of paper, and we're going to use the example of a client on their first visit. But really, guys and gals, we do a client intake on every visit. So the first visit, it can take a little while. It could take up to 15 minutes. Have you ever spent 15 minutes on a client intake? Yeah, I hope you have, because some of our clients, some of our patients have complicated health histories. Just know that to do a proper assessment, especially with a new client, it's going to take some time. We're going to have to read through their intake sheet. We get feedback, and you'll see what I'm talking about as we move through this lesson today. So just know that discussion and review of their health intake form every time. I love pulling a chart. I love having, if you guys use iPads for their charts, maybe where you work, they'll use iPads. But I'm a paper girl. I like having that paper. I like to make notes as we go along. And it also helps to build rapport with the client. So components of the client assessment are the health intake form, the visual analysis, the palpation analysis if necessary, and then maybe some special tests. Special tests are more like range of motion, but depending on where you work, if you work in a hospital setting, you may be trained in taking vital signs and taking their blood pressure. There might be a different protocol to your intake with a client. All right. The client interview, we're talking about the health intake sheet. There's all sorts of different forms of the health intake sheet. You can find many online. I have several examples I'm happy to send you. We want to look at all the systems of the body, and depending on where you work, you can evaluate their health intake form and just make sure you're getting all the details you need to operate safely and to meet the client's expectations. The health intake form is critical in meeting the client's expectations and ruling out contraindications. When we're doing our health intake, part of your client assessment is going to be asking open-ended questions. However, for the MBLEx, we need to do more than just ask open-ended questions. There are 3 types of assessment questions, and on the MBLEx, you could be tested on any, you could be asked about any of these. You will need to be comfortable understanding the different styles of questions. So this is about your communication skills, right? So general questions are open-ended. Specific questions are directed, closed, sometimes yes or no, sometimes 1 through 10. They're very specific, sometimes one-word answers. And then the third type of question is about their pain. So we have general, specific, and pain. Here's some examples of general questions. How are you feeling today? This allows the client to think, to tell you a story, to give you feedback, to expound. It's open-ended. What motivated you to come in for a session today? Oh, let them tell you the story. Hey, all right. Well, wow. Can you tell me a little bit more about your daily routine? What type of work do you do? All of these questions invite the client to tell you a story, to think, to reflect, to say more than one word. We're trying to get them to start talking because this helps us to assess how they use their body. Specific questions is when you're becoming the detective. Hmm. So, what area of your body are you feeling the most discomfort? And then, how about condition? Is your back stiff? Is it numb? Is it achy? Does it tingle? So, those specific questions. Okay, so you're having pain in your knee. Is it worse at night? Yes or no? So, a very specific question. Now, have you had the pain before? If so, when? Again, specific. However, look at this question here. On a scale of 1 to 10, how's your energy level? Energy. How's your energy level? It's a specific question about energy because the next category of question is the pain questions. Pain questions usually have the word pain in them. Sometimes the pain questions, the questions that have pain in them, are more general. Like, um, yeah, we'll talk about that later. But these are specifically pain questions. Where does the pain hurt? Where do you feel pain? How long has the pain been going on? What does the pain feel like? What triggers the pain? On a scale of 0 to 10, how much pain are you in? Is the pain constant it or only when it's touched or only when you move? How do you cope with the pain? These are all examples of pain questions. We're using the word pain. You are going to need to put your thinking cap on because the question has to be about the pain to be a pain question. Let me say that one more time. The question has to be about their pain to be a pain question. Otherwise, it's going to be a specific question. How are you feeling today? Well, that's more of a general question, but all right, you get the idea. 3 types of questions: general, open-ended, they're telling a story; specific, a lot of times very short answers, one-word answers. Um, Sometimes yes or no, true or false. And then pain, it describes the pain. The questions often use the word pain. So you may get asked, what type of question is this? All right. Time for some dissecting questions. Are you ready? Awesome. Final question. Ooh, I think this is the final question. For acute injuries, what acronym do we use to guide treatment? For acute injuries, what acronym do we use to guide our treatment? A, RICE, rest, ice, compression, elevation. B, PRICE, protect, rest, ice, compression, elevation. C, NSAIDs. NSAIDs stand for non-steroidal anti-inflammatory drugs. D, MEAT, movement, exercise, analgesics, and treatment. Let's get rid of one wrong answer. For acute injuries, what acronym do we use to guide treatment? Let's get rid of, we know we can get rid of rice now, right? We learned that today. For acute injuries, what acronym do we use to guide treatment? B, PRICE. C, NSAIDs. D, MEAT. 3, 2, 1, go. And Lek comes up with the right answer. Lily. Yes, Greta. Rachel, you got it. Diane. Good. Lance nailed it. Dantasia, boom, you got it. Lisa, yup. Carolina, yup. Ms. V, Julia, Amanda and Carrie, in. Brienne, good. Good, good, good. So, best answer is D, MEAT, movement, exercise, analgesics, and treatment. Now, this is a funny question because A, B, or D could have been the right answer. If you see this question on the MBLEx and rice is the only one, there's no price, there's no meat, rice is going to be your best answer. If you see rice and price, price is going to be your best answer. But if you see rice, priced, and meat, meat is your best answer. Good work. Yay. All right. That's a wrap. That is a wrap on client assessment, reassessment, and treatment planning. So, congratulations. You nailed it. Woo woo. Yeah. How's your brain feeling? Woo woo. It's a good one, huh? It's a lot to take in. It's a lot to think about. And I would really encourage you to find some clients. I know you're not licensed. You are allowed to practice. You're allowed to practice. You're allowed to practice and get a tip, get a gratuity. Yeah. Not allowed to charge, but you're allowed to practice. Yeah. Oh, yay. Good. Um, so I'm seeing clients. Oh, I have such a better understanding. Dora says I have a better understanding of assessment now. I'm so glad. Yes, that was the idea. Get some bodies on your table. Practice. You want to keep your skills sharp. And tell them, $20 tip. You're not charging for the massage, but you're open to receiving a tip, open to receiving a gratuity. Yes. So I'm going to hang out with these lovely people for a while. However, I'm going to end the recording by reminding you that my name is Jodi Scholes. I'm your instructor for the MBLEx review class. We meet here every week. We're doing this every week.